Today we will be studying the tongue and palate. In the tongue we will describe the mucous membrane of the tongue, then we will study the muscles of the tongue along with their attachment, nerve supply and actions. Then we will study the palate. We will name the bones forming the hard palate. Then we will describe the soft palate along with the muscles, their attachments and their nerve supply. Then we will describe the relations of the palate, and finally we will name the neurovascular supply of the palate. Tongue. This tongue is a mobile muscular organ present in the oral cavity. It is made up of skeletal muscles covered by the mucous membrane. This mass of skeletal muscle is separated into two halves by a midline fibrous septum. The tongue is conical in shape. It has three parts: the tip, the body and the root. The tip, body and root. The root of the tongue is attached to the mandible and hyoid bone by muscles. It is because of these attachments that the tongue is not swallowed during deglutition. The nerve and blood vessels of the tongue enter through this root, the tip. The anterior free end of the tongue, which comes in contact with the central incisor, is the tip of the tongue, and in between the tip and the root, the bulk of the tongue is formed by the body of the tongue. The body of the tongue has two surfaces, the dorsal surface and the ventral surface. The dorsal surface is convex on sides. The dorsal surface is convex on sides. It is divided by a V-shaped sulcus. It is divided by a V-shaped sulcus, the sulcus terminalis, into two parts. Anterior 2/3 are the oral part of the tongue and posterior 1/3 are the pharyngeal part of the tongue. On the ventral surface, this is the frenulum. In the lower part of the frenulum, on either side, there are elevations called the sublingual papilla. On the summit of these papilla opens the submandibular duct, and this is the sublingual gland that projects up into the floor of the mouth and produces an elevation of mucous membrane on either side of the frenulum. There is elevation of mucous membrane on either side of the frenulum. This is called the sublingual fold. Most of the sublingual ducts open into this fold. Now we will discuss the mucous membrane of the tongue. We will discuss the mucous membrane of the tongue on three surfaces. The surface anterior to the sulcus terminal, the terminal sulcus or sulcus terminalis, is the superior surface. Posterior to it is the pharyngeal surface, and inferiorly is the inferior surface. So first we will discuss the superior surface of the tongue. The superior surface of the tongue is covered by hundreds of papillae. Among them, one is the filiform papillae. These are the filiform papillae. The filiform papillae are small conical projections of the mucosa that end in one or 2 points. That end in 1 point or in 2 points. So these are the filiform papilla. Then come the fungiform papilla. These are the fungiform papilla. The fungiform papilla are rounder in shape and larger than the filiform papilla, and they are concentrated along the margins of the tongue. Then coming to the velate papilla. So this is the velate papilla. These are the velate papillae. These are blunt-ended. These are blunt-ended cylindrical invaginations in the tongue surface. There are only 8 to 12 velate papilla arranged in a single V-shaped line just anterior to the sulcus terminalis or terminal sulcus. Then lastly is the foliate papillae. The foliate papillae are linear folds of mucous membrane on the sides of the tongue near the terminal sulcus. Near the terminal sulcus there are present the foliate papillae, which are linear folds of fold like this. Linear folds of mucous membrane near the sulcus terminalis. The papillae in general increase the area of contact between the surface of the tongue and the contact of the oral cavity. All papillae except the filiform papilla, except this papilla, all papillae have taste bud on their surfaces. Coming to the pharyngeal surface, the mucosa covering the pharyngeal surface of the tongue is irregular in contour because of many small nodules of lymphoid tissue in their submucosa. These nodules are collectively called the lingual tonsil. There are no papilla on the pharyngeal surface. Now we will discuss the inferior surface. This is the inferior surface of the tongue. The under surface or inferior surface of the tongue has no papillae, but it has a number of linear mucosal folds. A single median fold, the frenulum of the tongue, a single median fold, the frenulum of the tongue, is continuous below with the mucosa covering the floor of the oral cavity. This fold overlies the midline septum of the tongue, which divides the tongue into two parts. So it overlies the midline septum of the tongue. On either side of the frenulum, there is a vein called the lingual vein. There is a lingual vein on either side of the frenulum, and lateral to the lingual vein is a rough fimbriated fold. This is called the fimbriated fold. So on either side of the lingual vein is the rough fimbriated fold. So frenulum, lingual vein on either side, and then the fimbriated fold. Now we will study the muscles of the tongue. The muscles of the tongue are two types: the intrinsic muscles of the tongue and the extrinsic muscles of the tongue. The intrinsic muscles of the tongue are within the tongue and they have no attachment outside the tongue, whereas the extrinsic muscle of the tongue take origin from structure outside the tongue and they enter to be inserted into the tongue. The intrinsic muscles of the tongue change the shape of the tongue, whereas the extrinsic muscles move the tongue and do movement like protrusion, retraction, and side-to-side movement, and can also alter its shape. The tongue is divided into two symmetrical halves by a median fibrous septum. So each half of the tongue contains 4 intrinsic muscles and 4 extrinsic muscles. The 4 intrinsic muscles, these are the 4 intrinsic muscles of one half of the tongue. These are the superior longitudinal on each side, the superior longitudinal, the inferior longitudinal, the transverse and vertical. And the 4 extrinsic muscles are the genioglossus on either side, the hyoglossus, the styloglossus, and the palatoglossus. So these are the 4 extrinsic muscles of the tongue. The intrinsic muscles of the tongue occupy the upper part of the tongue. They occupy the upper part of the tongue and they are attached to the submucous fibrous layer. They are attached to the submucous fibrous layer and the median fibrous septum. The intrinsic muscles are attached to the submucous fibrous layer and the median fibrous septum. So we will discuss first then the we will discuss the extrinsic muscles of the tongue. These are genioglossus, the hyoglossus, the styloglossus, and the palatoglossus. First, we will discuss the genioglossus. This is a fan-shaped muscle which arises from the superior genial tubercle and is attached to the whole of the tongue, and the inferior fibers are attached to the hyoid bone. Its section is that it pulls the tongue forward and protrudes the tongue, and so it protrudes the tongue when acting with its counterpart, other genioglossus. The two genioglossus combinedly pull the tongue forward and cause protrusion of the tongue. Then come the hyoglossus. The hyoglossus arises from the greater carnum and adjacent part of the body of the hyoid bone and is attached to the side of the tongue. It is attached to the side of the tongue. Its section is that these two muscles depress the side of the tongue and makes the dorsal surface of the tongue more convex. Then come the styloglossus. The styloglossus arises from the tip of the styloid person and the adjacent part of the stylohyoid ligament, and it is inserted into the side of the tongue its whole length, and its fiber interdigitate with the fibers of the hyoglossus muscle. Function is it draws the side of the tongue upward and backward. It draws the side of the tongue upward and backward. Then come the palatoglossus. It is a slender slip. It arises from the palatine aponeurosis of the palate and is inserted into the side of the tongue at the junction of the oral and pharyngeal parts, the junction of the anterior 2/3 and posterior 1/3. Its function is that it forms a fold. This is palatoglossus. So the palatoglossus forms a fold here, which is called the palatoglossal arch. This is called the palatoglossal arch. So its action of the palatoglossus is that it pulls up the root of the tongue, and it also approximates these two palatopharyngeal arches. Nerve supply of the muscles of the tongue. All the muscles of the tongue, whether intrinsic or extrinsic, are supplied by the hypoglossal nerve except the palatoglossus, which is supplied by the cranial root of the accessory nerve through the pharyngeal plexus. Now we will discuss the movement of the tongue. Protrusion is bringing the tongue forward. This is called protrusion. This is done by the genioglossus muscle of both sides acting together. Then is the retraction. Retraction is taking the tongue backward. This is done by the styloglossal muscles of both sides acting together. Then is called the depression. Depression is taking the tongue downward. Depression is done by the hyoglossus muscles of both sides acting together. Then is elevation. Elevation of the posterior 1/3 of the tongue is done by the palatoglossus muscles of both sides acting together. The intrinsic muscle of the tongue, the intrinsic muscles of the tongue change the shape of the tongue. With this we finish the palate. With this we finish the tongue. And now we will start the palate. First we will discuss the hard palate, and then we will discuss the soft palate. So first we will discuss the hard palate. This is the anterior part of the Norma basalis. This consists of two parts. This is the alveolar arch, the U-shaped alveolar arch, which is made up of the alveolar processes, the alveolar process of one maxilla and the alveolar process of other maxilla joins to form a U-shaped arch called the alveolar arch. These alveolar processes bear the socket for the maxillary teeth. The other part is the hard palate. This is the hard palate. The hard palate is formed by two bones, the maxilla and the palatine bone. The palatine process of the maxilla on either side unite in the midline through a suture called the intermaxillary suture, and they form the anterior two-thirds of the hard palate. Posteriorly, the horizontal plate of the palatine bone of one side and the other side unite in the midline through a suture called the interpalatine suture. So these two horizontal plates of the palatine bones form the posterior one-third of the hard palate, and there is a suture between the palatine process of the maxilla and the horizontal plate of the palatine, which is called the palatomaxillary suture. The palatomaxillary suture. These palatomaxillary sutures, the intermaxillary suture and the interpalatine suture, form a cruciform. So this is called the cruciform suture. Posteriorly in the midline, the posterior border of the hard palate has a projection called the posterior nasal spine. So this is the posterior nasal spine, and anterior to the posterior border of the hard palate there is an arch like crust which is called the palatine crust. So this is the area of the palatine crust on one side, and this is the area of palatine crust on the other side. Anteriorly, just behind the incisor teeth, is the incisive fossa. This is the incisive fossa, in which opens on two sides the incisive canals. The nasopalatine nerve and greater palatine vessels pass through these incisive canals. Posteriorly, in this region, there is one large opening and one small. The larger one is called the greater palatine foramina, and through this passes the greater palatine nerve and vessels. Posterior to it is another foramina called the lesser palatine foramina, through which passes the lesser palatine nerve and vessels. The mucosa of the hard palate in the oral cavity has numerous transverse palatine folds called the palatine rugae, and a median longitudinal ridge called the palatine raphe, which ends anteriorly in a small oval elevation called the incisive papilla. The incisive papilla overlies the incisive fossa formed between the horizontal plates of the maxilla immediately behind the incisor teeth. Now we will discuss the soft palate. The soft palate has an anterior surface or oval surface which is concave and is marked by a midline raphe, and a posterior surface which is convex and is continuous with the floor of the nasal cavity. It has a superior border which is attached to the hard palate, and an inferior border which is free. A small conical tongue-like projection hangs down from its middle, hang down from its middle, and is called uvula. On each side from the base of uvula, two curved folds of mucous membrane extend laterally and downwards. The anterior fold merges inferiorly with the side of the tongue. The anterior fold merges inferiorly with the side of the tongue at the junction of its oral and pharyngeal parts, and is known as the palatoglossal arch or palatoglossal fold. The palatoglossal fold contains the palatoglossus muscle. This one, the posterior fold, merges inferiorly with the lateral wall of the pharynx and is known as palatopharyngeal fold. This is the palatopharyngeal fold. The palatopharyngeal fold contains the palatopharyngeus muscle, and it forms the posterior boundary of the tonsillar fossa. This anterior fold forms the anterior boundary of the tonsillar fossa, while the posterior fold forms the posterior boundary of the tonsillar fossa. It is also called anterior pillar and it's called posterior pillar. The soft palate is made up of fold of mucous membrane enclosing 5 pairs of muscles. This is a fold of mucous membrane enclosing 5 pairs of muscles. This is the palate. The palate is related superiorly to the nasal cavities anteriorly and the nasopharynx posteriorly, and inferiorly it is related to the oral cavity anteriorly and the oropharynx posteriorly. So the palate is related to the nasal cavity, the nasopharynx, the oral cavity and the oropharynx. Now we will discuss the muscles of the soft palate. The soft palate consists of 5 pairs of muscles, 5 muscles on either side. This is the tensor palati or tensor veli palatini. This is the levator palati or levator veli palatini. This is the palatoglossus muscle, and this is the palatopharyngeus muscle. This is the muscular uvuli on either side. So there are 5 muscles on this side and 5 muscles on this side. All these muscles are extrinsic muscles of the soft palate except this one, the musculus uvuli. So this is the intrinsic muscle. Let us first discuss the tensor palati. The tensor palati arises from the lateral aspect of the auditory tube and the adjoining part of the greater wing of the sphenoid and the spine of the sphenoid. And the muscle descends downward, and this fiber converges to form a tendon which winds around the pterygoid humulus and then expand to form the palatine aponeurosis. Same on this side. So in between is the palatine aponeurosis. This palatine aponeurosis is inserted into the posterior border of the hard palate and also to the inferior surface of the hard palate behind the palatine crest. Its function is the function of the tensor palati is that it tightens the palate. When it contracts, it tightens the palate and it helps in opening of the auditory tube. Now we will study the next muscle, that is levator palati. The levator palati arises from the medial aspect of the auditory tube and adjoining part of the petrous temporal bone. The muscle runs downward and medially and spread out to be inserted on the upper part of the palatine aponeurosis. It is attached and inserted on the upper surface of the palatine aponeurosis. Its function is that it elevates the soft palate and it helps to open the auditory tube. So the next muscle is this palato-glossus muscle, going from the palate to the tongue. So it arises from the palatine epiglottis. It descends downward and laterally into the palatoglossal fold. This is the palatoglossal fold. So it arises from the palatine epiglottis and descends downward and laterally in the palatoglossal fold and is inserted into the side of the tongue. It is inserted into the side of the tongue at the junction of the oral and pharyngeal parts. It pulls the root of the tongue upwards, and it pulls the root of the tongue upward and approximates the palatopharyngeal arches to close the oropharyngeal isthmus. To close this part, they approximate. Next is the palatopharyngeus muscle. The palatopharyngeal muscle arises by two fasciculi. The anterior fasciculus arises from the posterior border of the hard palate, and the posterior fasciculus arises from the palatine epiglottis. This descends downward in the palatopharyngeal fold. It descends downward in the palatopharyngeal arch or fold and is inserted into the pharyngeal wall. So this is the palatopharyngeus muscle. So it is inserted into the pharyngeal wall and the posterior border of the lamina of the thyroid cartilage. So this is palatopharyngeus muscle, which has two fasciculi. One fasciculus arises from the posterior border of the hard palate, and the other fasciculus arises from the palatine epiglottis, and it descends downward and laterally in the palatopharyngeal fold and is inserted into the pharyngeal wall and posterior border of the lamina of the thyroid cartilage. When it contracts, it raises the pharynx and also the larynx. So it raises the pharynx and larynx during swallowing. Then the musculus uvuli. This is a longitudinal muscle strip on either side of the median plane within the palatine epiglottis. It arises from the posterior nasal spine and the palatine epiglottis and is inserted into the mucous membrane of the uvula. It pulls the uvula forward to its own side. It pulls the uvula forward to its own side. The nerve supply. All the muscles of the soft palate are supplied by the cranial root of the accessory nerve via the pharyngeal plexus, except the tensor palati, which is supplied by the nerve to medial pterygoid, a branch of the mandibular nerve. So only all the muscles of the soft palate are supplied by the cranial root of the accessory nerve through the pharyngeal plexus, except the tensor palati, which is supplied by the nerve to medial pterygoid, a branch of the mandibular nerve. The arterial nerve will study the arterial supply of the palate. The hard palate is supplied by the greater palatine arteries, which is a branch of the maxillary artery, and the soft palate is supplied by the lesser palatine arteries, which are branch of the maxillary artery and ascending palatine branch of the facial artery and palatine branches of the ascending pharyngeal artery. The nerve supply of the palate is: the hard palate is supplied by the greater palatine nerve and the nasopalatine nerve. The soft palate has sensory supply from the lesser palatine nerve and from the glossopharyngeal nerve, while motor supply, all muscles of the soft palate are supplied by the cranial root of the accessory nerve via the pharyngeal plexus, except the tensor palati, which is supplied by nerve to medial pterygoid, a branch of the mandibular nerve.